Ladies and gentlemen, thank you very much for kind invitation and introduction. I'm very honored to be here, and I would like to congratulate the organizing committee and also the sponsor of this wonderful, excellent symposium. Rapid technologies developments in the area of medicine provide us with a number of diagnostic and therapeutic options which lead to complex new ethical and social issues. Biotechnological interventions into the human genome, human embryonic stem cell research, or immunotechnologies used at the beginning of life are only some examples of these complex areas of applied technology. Developing an appropriate ethical and social discourse around these issues in order to help solve emerging problems poses a significant challenge for multicultural societies. Because the normative evaluation of basic research and their applications depends on diverse cultural and religious values and attitudes. On the other hand, the policies and legal regulations regarding these practices affect each and every person independently from their cultural roots and religious convictions. If we want a broad and extensive social and ethical acceptance of these research and biotechnologies, we should seek answer for some questions. These questions will be: how can we establish practices and legal regulations for applications of these biotechnologies which take into account cultural values and religious beliefs of society? How can we establish ethical and social discourse on new biotechnologies in which every member of society can participate and articulates their opinion? Which dynamics and arguments shape the ethical evaluation of biotechnology, research and applications in ethnic and religious groups, for example, in Muslim community or Muslim communities in non-Muslim countries? Regarding the last question, I will present in the first part of my presentation human embryonic stem cell research discourse among the Muslim scholars in Turkey. And in the second part, I will discuss the topic ethical challenges at the beginning of life and at the end of life in value-pluralistic societies. The Muslim population in Turkey officially includes over 99% of the citizens. Even if Turkey is a laical or secular state, it is unsurprising that cultural values and religious convictions play a decisive role in formulating ethical positions. Since there is no centralized religious authority in Turkey, unlike in many Christian countries, individual Muslim scholars have an important impact on people's attitudes toward controversial bioethical issues. This is especially true for a subject matter such as using human embryos in stem cell research, which provides a wide array of possibilities concerning human health, while the related research poses grave moral questions. I will present to you the results of our comprehensive investigation into this area, and the first of its kind, revealing a wide spectrum of ethical opinions on embryonic stem cell research held by Muslim scholars living in Turkey. Aims of our research were this was the research project of my master students, Ahmet Karakaya. He did these interviews, and our aims were to explore the positions of Muslim scholars living in Turkey towards embryonic stem cell research, and to analyze the arguments and methods of Muslim scholars used in ethical assessment of embryonic stem cell research. And we use as method semi-structured face-to-face interviews, grounded theory, and the transcripts were analyzed using open coding. And the characteristic of scholars, as we interviewed every Muslim scholar who is published or comment on the stem cell research. And you see here, I don't know, maybe numbers are not so clear, 15 scholars, and 9 of them is from the academia, and the 5 from the independent scholars, and 1 is the Directorate of Religious Affairs. This institution is a official institution in a state, is an important institution if we speak about bioethical fatwas, for example, but this institution is not, I will say, binding for every Muslim in Turkey. Our results are, as a result of analysis of the interviews, we determined that Turkish Muslim scholars use several normative reference points to evaluate the moral aspects of human embryonic stem cell research, and he defends different positions. And the normative reference points were, for example, moral status of the embryo, value of the acquisition of knowledge, and also normative power of health. If we look what is the main criteria for you if we speak about moral status of the embryo, they said 60% of the scholars said conception is a very important boundary for moral values. After conception, the embryo has a moral value, and 2 of them said implantation is important time to have a moral status, and 3 of 15 said that ensoulment is a very important time. And as you know, there are discussion in Islamic bioethical discourse. Part of the Muslim scholars says the 40 days, 80 days, or 120 days. There is also discourse in Muslim scholars. So the question, next question will be what is the moral implications of ensoulment? So 4 of 15 said that this is a categorical moral change. It means ensoulment is not the only clear boundary to have moral value, but it is important point. But 11 of the 15 scholars said it's a gradual change. So it is after ensoulment, embryo has a more moral value, but it is not to say that before ensoulment, embryo is nothing or has no moral value. And it was also for us surprising that to look what is the opinion about embryo. And then 30% of the scholars says embryos can be produced for stem cell research. So it was for us very surprising situation. I would like to similar Peter Singer's arguments in this context. But then 14% said excess embryos can be used for stem cell research. Only 1 scholar said so we cannot produce embryos for stem cell research, and we cannot also not use excess embryos from the IVF units for stem cell research. And I would like to give some arguments here. Pro-arguments said, for example, a scholar, Islam does not only allow this, it means stem cell research, but encourages it. In this sense, not only excess embryos stored in IVF units, but also all laboratory-produced embryos can be used in stem cell research. And we find out also contraposition. And he said, although most of the scholars nowadays accept using excess embryos in embryonic stem cell research, I'm personally not convinced that it is licit, because using these excess embryos in stem cell research seems like treating them as spare parts. Therefore, producing excess embryos and using them in stem cell research should be considered from the perspective of human dignity and should be avoided. And we see also the value of acquisition of knowledge was an important argument in our results. And Muslim scholars also consider studying and contemplating the things on the earth, including research on physical, chemical, or biological process and phenomena, as a duty for Muslims as well. The knowledge obtained from this research is a fruit of the fulfillment of a religious duty. So someone said the stem cell research is a religious duty, for example. I think it's a very interesting result. And also normative power of health was a very important argument for scholars, and they argue also the term maslaha, it means common good. Another result that we find these points interviews is that the majority of the scholars consider health to be a very important moral value in the ethical assessment of embryonic stem cell research, considering its central meaning and importance, seeking treatment and engaging in these preventing precautions are considered to be religious obligations. Of course, we have also limitations in our research. We cannot say this is a representative for Turkish scholars, and we have also we couldn't interview not every scholar in this context. So, as a conclusion of this part, I will say we find similar and different arguments in comparison to Western ethical discourse on stem cell research. For example, value of life or health, value of the acquisition of knowledge, but also different of foreign argument like ensoulment of embryos. So we have similar arguments and we have also different arguments. For example, the ensoulment of embryo is not important argument in secular or in the Christian discussion. And second important conclusion was for us that we have the heterogeneity of positions and plurality of arguments which we see in the Islamic tradition. So plurality is, I would say, it's not a new phenomenon in the 20th centuries or 21st centuries. So we can find in other religious traditions, like in the Islamic traditions, or also in Jewish or Christian traditions. But the question is for us, how should plurality in our own country be handled? What's the meaning of the different Islamic arguments and positions in a Muslim country and in a non-Muslim country, for example, in Germany? According to these questions, I will present a real case which shows some ethical problems by using of modern technologies at the beginning and also at the end of life in the second part of my presentation. In multicultural societies, encounters between doctors and patients from different cultural backgrounds are an everyday occurrence. For example, we have about in Germany 20 million people with migration background. Consequently, about 4 million of them are Muslims. Consequently, their concepts of health and illness may be defined differentially depending on their respective cultural understanding. Thus, there may be divergent assessment of the disease, value of a given condition, degree of suffering, and therapeutic goals. Intercultural doctor-patient conflicts arising out of different value systems to which the actors subscribe cover a broad spectrum involving various problems and complexities. One of the more difficult conflict areas is undoubtedly the decision-making process concerning therapeutic goals at the beginning of life and at the end of life. At this point in time, cultural and religious values becomes more dominant when it comes to decide about medical interventions. This can lead to a number of different conflicts when trying to reach a joint decision in an intercultural setting. Now I will present a real case in Germany. I was at the Medical Faculty of Mainz, and I was also a member of a clinical ethics committee during this case, and I would like to present this case in order to show how complex the ethical conflicts at the beginning of life and also at the end of life. A 6-day-old child of Turkish Muslim parents is suffering from type 2 autopathogenital syndrome, a rare genetic disease leading to servo anomalies in the formation of seminal organs. Previously, the mother had lost another child in the 37th week of this In a second pregnancy, she had suffered a miscarriage in the 17th week. In this case, the fetus was examined and a molecular genetic test found the presence of a type 2 autopathogenital syndrome. Father and mother are third-degree relatives. On that occasion, the mother was diagnosed as a carrier of the relevant X chromosomal mutation. The parents would accept a pre-implantation genetic diagnosis because of their religious convictions and cultural values. I can imagine also from the understanding of ensoulment of embryo and so on. But at this time, in 2006, PGD was not legally allowed in Germany. So we have here interesting intercultural conflicts. In her third pregnancy, during the 4th month of gestation, the parents presented a specialist clinic where the OPD2 syndrome was diagnosed in the fetus too. However, the parents rejected a legal abortion and decided to leave the pregnancy to its natural course because of their Islamic belief. They did not seek any further consultation or care. Without intensive mechanical support, the child was not viable even with the use of machines, especially the ventilator. Most likely the child would have been kept alive only for a very short time span. With the help of a relative of the parents serving as an interpreter, a consultation is undertaken. The German medical team suggested refraining from providing maximal therapy and limiting the extent of therapy. However, the parents requested a continuation of all life-prolonging measures for their child, even if there was no perspective of cure. They emphasized that their decision was based on their Islamic faith. Had they decided otherwise, they would not be able to justify their action in front of God in the other world, in Arabic, Yawm al-Qiyamah. In this case, we have not less than two main conflicts. In the first ethical conflict is the wish of parents to PGD, which is not allowed in this time Germany. So after 2011 is under some circumstances allowed, but I'm not sure if we have this case, we will become the allowing for the PGD. So it was not so clear. Second ethical conflict is conflict between medical recommendation of therapeutic team and the decision of parents. This conflict of interest and of decision-making between the parents of the sick child and the healthcare team is in the determination of the therapy goal. Within the team, there is a consensus about the fact that the current therapy should not be extended to other interventions, even if this attitude would cause the early death of the patient. And the reason for this position was the medical futility situation, and the parents argued against this position. In their opinion, all available interventions must be applied in order to lengthen the life of their child. So we have similar conflicts where on the one side, Muslim parents or parents with migration background want so often, significantly often, these maximal therapy. We have similar situation also, I think, in the Netherlands and so on. It's a, I would say, classical conflict situation in non-Muslim countries. The parents cannot accept any other decision because they cannot take the responsibility in the last judgment. The conflict becomes more complex because we have here some barriers. And if we look in the intercultural treatment situations, we have in this situation communication barriers because we can, it was possible to communicate with parents only with the interpreter. And there were also special, I would say, ceremonies at the end of life, the wish of the parents. And we have also moral diversity. That means what's the term of medical futility? What is the meaning of the term the best interest of the child? What is the meaning of the cultural convictions or religious beliefs and so on? So we can find in this interesting case all of the barrier forms. As reflections and conclusions on this case, we should consider that the ethical conflicts in intercultural treatment situation can have a different ontological character, and therefore they are difficult to objectively accessible to the other conflict partners. In understanding process of intercultural conflicts, we need not only language interpretation, there was a cultural hermeneutical translation. Cultural hermeneutical translation was very important in this case. In the case just discussed, there was a conflict between the potential limited prolongation of life through the use of maximal therapy and the shortening of suffering through a change of the therapeutic goal of limitation of therapy. In order to reach an ethical tenable solution, these values needed to be balanced against one another to choose a legitimate course of action. Central in this weighting of interest to access the ethical aspects of the decision to be taken were the declaration of medical futility with its medical implications and the child's best interest as an ethical norm. An ethically adequate approach to conflicts arising in basic research or at the beginning and at the end of life, not only a response to these questions, but also finding a balance between conflicting values. This balancing act opens up another range of issues due to confrontation of culturally based differences in the attribution of values. Such diverse attributions of values to be conflicting normative terms have not yet been sufficiently taken into account in the intercultural debate and research. Looking back, we can see that we are in need of elaborating concepts for dealing with the kind of divergent value attributions. In a value-pluralistic society, those endeavors need to embrace different culturally based value systems. We need also more sophisticated research and analysis about the ethical problems of interculturality and normative terms like determining beginning of life, moral status of embryo, stem cell research, regenerative medicine, etc. It is also required a perception of cultural phenomena. Through this process, we can understand ethical challenges of new biotechnologies research and interventions in a value-pluralistic society, even though we may not be able to solve every single conflict that will arise. So, Dr. Surani asked in his presentation, what makes us human? So I think it's a very important question, but I think it is not only a question of the natural sciences, it's also a question, interesting and very important question for philosophy, theology, sociology, and so on. As an ethicist, I have no patent solution, or as a physician, I cannot write a recipe, but I can say we need to be aware of the complexity of the stem cell research or regenerative medicine in a value-pluralistic society. And we need also to understand of complexity of these problems. And therefore, we need, I think, a lot of bridges. And my last slide, so as you know, this is a very famous bridge in Lisbon. I am from Istanbul, and we have 3 bridges in Istanbul because of chaos of traffic. And we need more bridges, not only in Istanbul and Lisbon, but also we need interdisciplinary, intercultural, interreligious, ethical, ontological, metaphysical, and spiritual bridges. Thank you for your attention.